Best way to treat jowls, nasolabial folds, festoons. I have lower facial sagging, jowls, and nasolabial folds that I would like to eliminate. I believe all are due to aging and my pregnancy in 2006, when I gained weight mainly in my face and stomach. I'm 44 years old, thin, athletic. A surgeon has recommended a mid-facelift, anterior neck lift with liposuction, and lipo of the fat pads on my cheekbones. Are these procedures the best way or the current standard to smooth my face and jawline?
Thank you for your question. At the age of 44, you are asking about issues related to the nasolabial fold and jowls, and you've gotten some recommendations from a surgeon about some procedures. So the, the key thing that I think we should first do is define what is happening in your 40s that is resulting in these changes. And something to remember, and I actually mentioned this in my book, The Fine Art of Looking Younger, is that when you hit around the fourth decade or so, you really start to manifest some of the volume loss and facial descent changes. Basically, there's two parts of facial aging that people become acutely aware of. One is there's loss of bone, muscle, fat, and the skin gets thinner, and that's called volume loss. And so it's like the face kind of collapses in a little bit, and then the lines become a little bit deeper. And in addition, there's looseness of skin and the supporting tissue. So the question to answer first is, how much surgery are you ready to undergo for possibly relatively modest changes? So be sure, like, let's talk about the nasolabial fold, for example. The nasolabial fold, this area often referred to as the parentheses. Very often the solution by a lot of surgical colleagues is to try to do a mid-facelift, which means to lift the mid-face, this cheek area, and go vertically upward and try to soften the nasolabial fold and create a higher cheek fullness. From my experience and over the past 20 years of different mid-face lifting procedures, I have found that some of those procedures tend to push the mid-face too wide, and others look very good in the beginning where everything is high, and then eventually it tends to descend. So you have to ask yourself also about how much this area bothers you. The one thing that I can't determine from your photos is, of course, how the skin feels. When I evaluate a patient, I look at them and I move the skin to see how much movement there is. Basically, lifting procedures, there has to be something loose to lift. If something is not that loose, then you're not going to be able to move it very, very much. So you may want to consider more conservative options related to the nasolabial fold. Again, this is only based on a physical examination. When you're asking what's the best procedure for jowls, well, when someone has loose skin in the jawline and it looks jowly, well, my go-to procedure is some type of facelifting procedure. And why is that? Because as the face descends and sags, we are able to very successfully redefine the jawline by lifting the skin and the soft tissue underneath, called the SMAS. The SMAS is often referred to by a lot of people who do research about facelifting. It's called they refer to it as the muscle. It's actually the tissue that supports the skin and has to be tightened. But essentially, when you look in the mirror and you lift your skin in this direction, in an upward and back direction, not pulled back and not pulled too up, but in that direction, then you can get an assessment of how loose and tight your skin is. So before you proceed with a surgical procedure, with a combination of procedures, see if your surgeon really understands what your expectations are. You know, sometimes there's a miscommunication where surgeons are happy with some type of improvement, but the patient wanted maybe something a little bit more dramatic or didn't want something so dramatic. So it's critically important that you communicate with your surgeon, and you may want to get more than one opinion before you commit to any extensive surgical procedure. And it may just be a combination of moderately invasive or less invasive with minimally invasive at this stage of your life. Again, it all depends a lot on physical exam and what your desired goals are. So I hope that was helpful, and thank you for your question.